Welcome Mid-South Management employees to your annual open enrollment overview. During this presentation, we'll cover important annual enrollment information. We will discuss eligibility and qualifying events, how to enroll in your benefits, review benefit plans and options, and provide important contact information if you have questions during the enrollment process. Annual open enrollment will be open from January 2nd through January 25th. Open enrollment is the one time a year that you can make changes to your benefit elections, such as adding or dropping coverage, or adding dependents. All employees must go through open enrollment and make new elections for 2023. Benefits are provided to all regular full-time employees, working at least 30 hours a week. New employees are eligible for benefits on the first of the month, following 60 days of employment. New benefit plans go into effect on February 1st, 2023. Your benefit elections will remain in effect until January 31st, 2024. After annual open enrollment closes, no changes can be made unless you have a qualifying event. Examples of a qualifying event are a marriage or divorce, birth or adoption of a child, death of a dependent, or loss of other coverage. You will have 30 days from the date of the qualifying event to notify HR and provide written documentation of your benefit changes. You can visit www.msms.eqpbenefits.com to review benefit summaries, plan options, rates, and more. Once open enrollment is open, you can click on the Enroll button to log in and complete your enrollment. Your benefit choices this year still include a medical plan through Blue Cross Blue Shield of Tennessee, along with a secondary medical plan through Pre-Med Defender. There is also voluntary dental and vision plans, offered by the Standard. Pre-Med Defender is a group secondary health plan that enhances your primary medical plan. It provides benefits to help reduce your out-of-pocket medical expenses like co-pays, deductibles, and co-insurance. Pre-Med Defender mirrors your primary medical plan benefits and PPO network, and it pays directly from your primary plan's EOB. Your medical plan will utilize a two-card ID system. This will include your primary medical plan through Blue Cross and your secondary medical plan through Pre-Med Defender. It is important that you always present both ID cards when visiting providers and pharmacies. Providers will file your claims to both medical plans. Let's look at how your primary and secondary plan work together to help lower your out-of-pocket costs. Your Blue Cross plan has a calendar year deductible of $7,900 for an individual and $15,800 for a family. This plan includes a co-insurance limit of 50%. Your calendar year maximum out-of-pocket limit on this plan is $7,900 for an individual and $15,800 for a family. All medical services, including office visits, emergency room, and urgent care visits, as well as all other inpatient and outpatient services, will be subject to deductible and co-insurance. Preventative services will be covered at 100%. Prescription drugs will also be subject to deductible and co-insurance. Now let's look at your Pre-Med Defender secondary plan. Pre-Med Defender replaces your Blue Cross deductible with a calendar year deductible of $500 for an individual and $1,000 for a family. Pre-Med Defender also reduces your co-insurance percentage to 0% and pays up to $7,400 for an individual and up to $14,800 for a family. Pre-Med Defender also provides first-dollar copays of $35 for primary care visits and $50 for specialist visits. Pre-Med Defender pays up to $7,400 for emergency room visits after the Pre-Med Defender deductible has been met. There is also a $75 copay for urgent care visits. Pre-Med Defender also pays up to $7,400 for advanced imaging and outpatient surgeries after the Pre-Med Defender deductible has been met. Preventative services are still covered at 100%. Pre-Med Defender also provides first-dollar copays for generic and preferred brand drugs. Let's look at how your plan would pay, based on a $15,000 hospital stay or outpatient procedure claim, utilizing an in-network provider. Your primary Blue Cross deductible is $7,900 and your total out-of-pocket responsibility would be the full $7,900 before Blue Cross Blue Shield would begin to pay benefits. However, Pre-Med Defender replaces your Blue Cross deductible and lowers it to $500. Pre-Med Defender pays benefits of up to $7,400, which reduces your net out-of-pocket responsibility to $500. Voluntary dental insurance is provided by the Standard. With this dental plan, you can visit any dentist you choose. However, you can receive deeper discounts if you visit in-network providers. There are no waiting periods, and diagnostic and preventative services are covered at 100% with no deductible. There is a $50 annual deductible for basic and major services, with a maximum of 3 deductibles per family per year. The plan pays a calendar year benefit maximum of $2,000 per person, and dependent children are covered until age 26. Voluntary vision is also offered by the Standard. This vision plan utilizes the iMed Access network, with over 60,000 locations nationwide. There are $10 co-pays on exams and $25 co-pays on materials when visiting in-network providers. The plan allows up to $130 on frames or contacts, plus additional discounts on services such as LASIK and PRK procedures. Dependent children are covered to age 26. Let's review. Annual open enrollment is now open. Your new benefits take effect on February 1, 2023. Everyone must go through open enrollment and make new benefit elections. Make sure to have dependent Social Security numbers and dates of birth available when enrolling. Enrollment elections can be completed online. Visit msms.eqpbenefits.com for more information. Need help during or after open enrollment? Please contact EquiPoint Partners. Agents are available Monday through Friday, from 8 a.m. to 5 p.m. Central Standard Time.